Good morning, everyone. Mine is a bit of odd man out. It's not a clinical thing, it's a bit of basic research. Melphalan and the boron nitride nanotubes in the eye using density function theory study. So basically, we all know there is a global burden of cancer and it is catching up. And by 2050, we can expect 30 million people with cancer being detected, and no eyes being no exception, with all types of melanomas, lymphomas, sarcoma, and carcinoma. So, what are all the challenges? These are general challenges in cancer management, awareness being inadequate, there are a lot of misconceptions and taboos, and it's a huge economic burden both at the individual and the societal level. And there's a disproportionate distribution of healthcare and added to the expensive and inaccessible options. And even expert healthcare requirements are not adequately met with. And at the patient level, there's a long stay with the systemic complications, permanent disability, and insufficient rehabilitation, as we had seen in real time with the previous presenters. We can diagnose, but they're lost to follow up because of various social reasons. So, what are all the recent advances? So, all the ocular tumors are being customized. The treatment is being customized with various options like surgery, radiation, targeted therapy, immunotherapy, reconstructive procedures, and even sometimes clinical trials for the new treatments. I would like to concentrate on the targeted therapy. So, targeted therapy, we all know, to avoid the systemic complications, because most of the complications are because of higher usage of medication, as we have to give it intravenous, though we do give some intravitreal and intraarterial, though they are not very commonly practiced. So, nanocarriers could be the answer for the targeted delivery with their 10 to 100 nanometers size. And various tubes, nanocrystals, polymers, liposomes are all being tried for this. And among these nanotubes emerge as a unique nanocarriers because they have a high surface to volume ratio among the other properties. Carbon nanotubes were studied initially for the biological application, but then they fell out of favor because of the biocompatibility issues. Then came the boron nitride nanotubes, which are similar to carbon nanotube in most of the structures. And this Ciofani et al. Have done extensive studies regarding the biocompatibility, and it's been established. The other challenge is making them dispersible. You can't make them into a solution. So we have to do a bit of surface functionalization with other groups to make them dispersible, which can be applied in medical use. So the novel idea what is being conceptualized is because Melphalan is being used in various ways in eye, intravitreal, intraarterial, and even subconjunctival. So we thought we can take it up Melphalan and see whether it can be used as the targeted therapy, and various routes of administration can also be tried. With the BNNT, as I've already told, they have been functionalized with OH group to make them dispersible. So, density functional theory is basically based on a solver equation simulation. To make it simple, basically by simulations, by running various computer-based simulations, it can predict whether there is a possibility of conjugation of the drug and the carrier. So, it is a computational study. These are the BLP B3LYP is the commonly used technique. It involves initially optimizing the drug, and then these are all the various parameters. Basically, we study the angles and the bond length and other things, which is more feasible for conjugation. Then comes the carrier, again that is optimized with the OH group in place with the various parameters. And this is the finally it looks how the computational optimization looks, and this is the boron nitride. It is a hexagonal structure. And then we have tried various locations of the OH, because that again determines the drug carrier conjugation, different variations. And finally, this is the formula based on which the adsorption energy is calculated among various parameters. This gives as an idea as to whether the conjugation is possible. So we can see that Melphalan can be engulfed inside the nanotubes we have tried various diameters. 8.28 was the optimal thing. So the adsorption energy was found to be minus 0.138 CV Hatry. Basically what it means is it shows there is a possibility of loading the Melphalan inside the nanotube without the aid of any external simulation, and it also confirms the spontaneous adsorption inside the thing, and it can also very well carry the drug to the site before it undergoes other changes. But these are the very nascent results. At least the concept is favorable, because it has to be, nano drug delivery is a promising technique, but I being unique with a lot of barriers, it becomes even more challenging. But they hold a hope because of their huge payload, and the same kind of drug concentration can be attained even with the subconjunctival subtenons and topical instillation, which can help in reducing the morbidity, so that it can be practiced in the existing setup. But the bigger challenge is we have to validate the study with various cell line studies and animal studies, and also from the nanotube point of view, they have to be, the size has to be determined, it has to be upscaled before all these things can be done. So I would like to acknowledge these people who have helped me with the DFT studies. So the references, and thanks.
Do you have a clinical establishment with your institute, or you are into a research wing?
No, I'm a practicing clinician with Agarwal's Eye Hospital, and I've also done my PhD in drug delivery.
Wow. That's what it's
yeah. So I'm just, I try to make it simple. I'm just trying to bring the gray areas in our clinical practice with the basic research. So in my own study, I have done on zebrafish. Have tried to instill the boron nitrate conjugated Melphalan over the contact lens. So it has shown promising results where the drug is infusing into it. But as I've told, it has to be validated.
So far, only one drug, Melphalan, you have tried with that carrier.
Yes.
So others can also be in due time.
Yes, that is the thing.
So have you tried this
I have
in
tried
a clinical trial, Melphalan on human?
No.
So still in that phase?
Correct. I have only done the zebrafish, which is accepted as a small animal study. It's accepted as a small study.
Good one, very good.
Yeah.